You have it.
Aloha, my name is Mia Lisa. DHA said today that the epidemiologists from the CDC are on island now. Why are you not telling the impacted families? Why are they on island?
Answer that.
How do impacted families participate in the study and get information on what's being studied?
Sure, I can answer that. So that's not related to this episode. That's related to Red Hill. That's a follow-up, what we call an EPA from CDC. The Defense Health Agency asked CDC to send epidemiologists out to review medical records from the military health system medical record for people that have had medical problems related to Red Hill, including people who have been seen at the Red Hill Clinic over the past couple months, but also going back over the last year.
Is the Red Hill Clinic working?
The Red Hill Clinic has seen, I don't know the exact numbers, but over 50 people. As far as the satisfaction from the people that have been there, I don't know the answer to that. I'm not part of the Red Hill Clinic, but the CDC team that is here is doing a complete review of the medical records of people impacted by Red Hill over the past 14, almost 15 months now. So that's why they're here on island right now. They're not doing a health survey like they did the first 2 times. There's not public participation in this. It's purely a review of the medical records from the military health system.
The part that I've been involved with Red Hill, for example, has been the health connection too, because I'm a physician and I'm the only physician in the environmental side of DOH. So I've been sort of the key health connection. So like getting CDC to come out and do those health surveys, I asked for it, I directed them, I helped them formulate all their stuff and kind of guided them through that. They had to bring the expertise because I'm not an epidemiologist, but my role was to like liaison with them, ask them to come do it and sort of be their local person. And then we're doing all the analysis on all those health surveys. We did a fair bit of analysis on the first one and that's been published in a few places, but we're doing more. And then the second one, we're still analyzing the data because it's this huge data set. We had almost 1,000 people in the second one, which was really good. But I'm not an epidemiologist, so I don't have the skills to do all that part of it.
Okay. This is Mandy.
I've talked to Mandy before.
Oh, sorry. How do I?
Hey, Diana, can you hear me?
I can see you. I can't hear you.
Now.
I can hear you. A little better, yeah.
Hey, I had a question. I heard about the epidemiologist study, and are our records being looked at? Like, are family members going to be able to know about the epidemiologist study?
I don't know about they'll know the results will get published for sure publicly. I don't know the logistics of the data sharing agreements on it.
But they're looking at our records, right? Like impacted family members?
They're looking at the records in Genesis, which is the military health system records.
Okay.
But de-identified, they're not looking, there's no identifying information as far as I understand. But I don't know, like I said, I don't know the details.
Okay. How are we as family members not being informed that they're looking at our records and that they're on island?
I don't know. I can direct you to DHA who did the request and stuff. I have not been involved in this really at all. I have purely offered them workspace.
Yeah, I just heard you tell the group that you were the one that got them to come on island. So now I'm...
No, that was for the first 2. That was for the health surveys, not this one. This was DHA requested. Department of Health is not involved with this one.
Well, how are you tracking it if you're not involved?
I'm not tracking it. I mean, I know they're here because I offered them some space to work because they reached out and asked for space to work. And so we offered them space at the Department of Health, which they didn't take us up on. So I know they're here, but I have not been involved at all with any of the planning, the data sharing, the agreement that they set up. So I don't have any details. I'm sorry.
No, it's fine. I find problem with the fact that you, Department of Health, are tracking that these people are on island, but someone like me or any other impacted family member, they're looking at our records and we're not tracking that they're on island. We're not tracking what they're there for. We're not tracking what, like, we're not involved at all, but they're studying us. But someone like you know what I mean? Like, not being studied or tracking it, but someone like me who is being studied, I'm not tracking it. So I guess that's where the communication breakdown is, and why we keep saying that there's been all this transparency, but now we're finding out that, you know, there's epidemiologists on island, which is something that we have been as family members asking for this whole time. And now they're on island and we have not been told anything about it, but yet they're looking at our records. Do you see an issue with that?
Sorry, say that again, the last part.
Like, don't you find an issue with that? Or would you find issue with that if you were an impacted family member and someone was looking at your records and you weren't even being notified?
I don't know how to answer that. I'm not coming from your perspective. So, but I understand that why you're concerned. I think that makes sense. I don't have a solution for you except to take it up with DHA. I'm sorry.
Contact? I mean, because there's obviously 93,000 people impacted by this, and we're just hearing this to the grapevine today at a town hall.
Yeah. The point of contact would be Kevin Nakamura, who's the DHA lead, DHA Indo-Pacific lead.
Okay. Got it.
I can email you his information if that would be helpful. I don't know if I have a phone. I don't think I have a phone number for him, but I have an email.
So to be clear, the Department of Health is not involved at all whatsoever with the CDC epidemiologists being on island or doing any sort of review on our records or looking at health at all from a Department of Health standpoint.
So we have an epidemic investigative services officer stationed in the Department of Health. He's also part of CDC, and he's assisting with the effort. So he is part of Department of Health and CDC. So he is involved. So that is one part of Department of Health that is involved in the effort.
Okay, so why are you sending me on a wild goose chase then to say it's DHA if you guys are involved?
Because he's a worker I'm trying to send you to the highest level person involved.
Okay.
To get the information, because I don't believe that our EIS officer was involved in the planning and the data sharing and the things that you just mentioned you were concerned about. So I was trying to send you to the highest level person involved to get the information from the top.
Yeah. So I guess I'm just concerned that a state entity, which is you all, now is reviewing a federal agency, which is us, in federal records, which is our medical records. And we, the family members, have not been informed about this and are not even a part of this. Yet we're being looked at without even being told. But the state has more access to our records and what is being studied and information. And we as family members are not involved in that conversation at all.
Okay. Amanda, I completely understand your concerns, and I'll take it up the chain at the Department of Health. But I can't argue this right now because we're trying to talk to people about PFAS here in this neighborhood right now. So I will certainly take your concerns to DHA. I'll take it up the chain at Department of Health. I understand your concerns, and, I think you make a valid point.
Okay. Thank you.
Aloha.
Do you have more questions
Yes.
about CDC?
Yeah. I heard about the clinic was hard to even, it's just starting or not even opened yet.
They started in January, and they had some rough start. The triaging call effort to get into it, I guess, was a mess. They fixed that. They haven't had the response and the number of people coming to the clinic that they wanted.
Probably because all those families had already had to be restationed.
Some of them were restationed, but I think it's also a trust thing. A lot of people just don't trust the military. And I totally get that. Why would you, right? I applaud DHA. So the bigger picture is that the Navy did all this, right? At the time that happened, public health in the armed services was split up among all the different branches. So the Navy had their own public health people, and the Army had their own, and the Marines had their own. It was all separate, and it was not smooth, right? They don't get along. That's right. And so they were trying to combine together, and it took a while for them to get in a rhythm. And then once they've kind of combined together into the Defense Health Agency, kind of all one. Since that happened, and we've had Defense Health Agency presence on Oahu, now they're actually like starting to do stuff about the health. And part of that is because of those health surveys by CDC, right? Because when you look at the toxicology or the physiology of the exposure, we didn't expect the symptoms to last long. It just, physiologically, you wouldn't expect that. But then we did these health surveys and we heard from the community that people were still having symptoms and it doesn't make sense. We don't know why. And that's partly because we don't...
It's poison.
Yeah, well, but it poisoned people initially, and that was expected based on the science of it, right? That people would get really sick when they drank it. But we didn't expect people to keep feeling sick and keep having health problems. But then they did. And we knew that from what we heard from the community. We knew that that's why we had the CDC come back and do that second health survey, because we were hearing it from the community that they were still sick. So with that evidence from that second health survey, we were able to say to the Defense Health Agency, people are not better, people are still sick. And then from that, they finally, slow wheels turning, finally started to do something. So the Red Hill Clinic was the result of that. Their health registry, the long-term health registry they're going to do is because of that. They've done some efforts to start to educate providers both within their own system and in the community and across the country, so when people are relocated, they go. So they're finally starting to do something, and I think a lot of that has to do with the efforts that we put in with CDC and that health survey showing like, no, this isn't over. People are still suffering.
Hi.
Hi.
Hi, Ernie.
Hi, yeah, hi, Mandy.